If you guys have watched my videos before, you know that I talk about monsplasty a lot. And the reason for that is because for a lot of women and men, if you've lost a lot of weight, there's extra skin over the mons. Even if you haven't lost a lot of weight, some people have extra fullness over this area. And if you're doing any sort of skin removal and you don't address the mons, it can look super weird afterward. I've had people come to me specifically for monsplasty after already having had abdominoplasty. And ideally, they should be done at the same time because it's literally the same incision. So let's get a little nomenclature straight. The pannus is that lower part of the abdomen. Pannus literally means apron. So it's that apron of skin. Mons, which I think means mountain, is the mound of soft tissue at the top of the pubic area. It's the mons pubis. So when you're making an abdominoplasty incision, you can lift up on the mons as you're pulling down. So the first part of making sure you have a flat mons is doing a very low transverse incision. So it's right at the top of the mons because the mons is going to pull up. And when I mark my patients, I lift that area as aggressively as I can. So the incision's often within the hair-bearing skin. And that's going to lift the mons up as the abdominal skin's pulled down. Now, in some people, that's plenty. In many people, that's plenty. But some people who have lost a lot of weight, if you only pull upward, you still have puffiness, just only in the horizontal dimension instead of the vertical dimension. So sometimes I will take little darts of skin in that inguinal crease. So you're looking at a back cut here and here to take out a little triangle of skin. If I'm only doing an abdominoplasty, then I make those back cuts. If we're doing a thigh lift, that's the thigh lift incision anyway, so that will help. But the key is to bring that in onto the mons so that you're pulling it tight horizontally as well as vertically. And that makes a really big difference. Liposuction also can help. And then some people do have a prominent pubic bone, which that I can't address. But just making sure that you lift the mons enough with abdominoplasty and then take out the horizontal excess too if needed makes a really big difference.